Hi everybody, Dr. Cary Yurkiw here. I'm a chiropractor in Kelowna, and today we're talking about transformation, how we take a patient from being in pain and discomfort to restoring their life back to the way it used to be. So today I have a couple slides for you. I'm just going to switch over to my first slide right here. And yesterday we were talking about the different causes of neck pain, and some of those causes were things like injuries, whiplash. We talked about poor posture, whether it's sitting at your desk or maybe you're looking down, text neck we call it, or maybe it's work related, like you're a plumber and you've got your head and neck in an awkward position underneath the sink, let's say. So we talked about those things. We didn't talk about arthritis, which is a very common cause of neck pain as well. Both osteoarthritis and rheumatoid arthritis. The difference between the two being that osteoarthritis is a wear and tear of the bones and joints from use, and rheumatoid arthritis is more of a systemic inflammatory disease. So we'll be talking about that as the days go on, and we're digging a little deeper into neck pain. So when someone comes in with neck pain, we want to take them from where they're at, usually a lot of pain and discomfort, and that's why they come to see us, to being pain-free and living the life they want to live again. So I'm just going to switch slides here. And the way that looks is like this. When somebody comes in the clinic, obviously they're feeling really bad, they've got a lot of pain and discomfort, and they want to transition from this stage, being pain-free, and want to do the things they love to do again. So in my clinic, the first step is just getting the pain to reduce, increasing the range of motion, improving the alignment. And then once we're in that phase, then we want to get the patient more involved, doing some exercises and stretches, making some lifestyle changes, preventing a reoccurrence of the pain and discomfort. And then we want to encourage our patients to take the next step. And that's really where it makes, the care makes a big difference, because we want to encourage our patients to feel even better than they were before, to have better neck health, have better overall health in general, their sleep posture, the type of pillow they use, nutrition like diet, exercise, stress levels. All of those things are really important to transition a patient from being in pain and discomfort to feeling excellent. So if you are someone who lives in the Kelowna area and you're interested in coming to the clinic, we are accepting new patients. You just have to click on the link below or call the number. I'd be happy to help you. We will do a history, initial exam, start treatments. Then we'll put together a plan for you to take you from being in pain and discomfort to being healthy, being in less pain or pain-free, and doing the things you love to do again.